What is amazing about Legacy and our mission is we want to take care of our people and we want to do it in their community. So what we want to do is make sure we continue to deliver that level of care in Gresham. The Legacy Cancer Institute has one of the best breast programs, no bias, in Oregon. And I say that because we have a long history of being first in promoting technology. And you know what? I think the thing that makes me the most proud is we do it all with heart. Dr. Zakhireh is our dedicated Mount Hood breast surgeon, and she is awesome. We recruited her from Memphis. She's very well trained, but more importantly, she brings her whole heart to patient care.
Unfortunately, breast cancer is still commonly diagnosed. We win more than we lose, but we still lose more than we should.
There are some trends that we've seen recently in cancer that are important in the Gresham area. One, we're starting to see younger people with cancer, and we also tend to see sometimes later diagnosis.
We're really growing the program at Mount Hood and excited to see more patients receive care close to home.
So Mount Hood serves so many catchment areas. I mean, there are people from the east side of Portland. If you've ever been on the Banfield, you know why it might be easier to come out to Mount Hood than head more centrally. But then also the Gorge, you know, and some areas in Washington are closer to the Mount Hood region. So it's really important for us to provide that level of care because we have so many people from those regions that are counting on us. And having a new Trident is part of that. The Trident is a machine that takes little x-rays. We also call it the Easy Bake Oven because it's kind of what it looks like. And so once we remove the breast tumor to confirm that we actually got the lesion, we put it in the Easy Bake Oven or Trident, and it takes a quick picture for us. So that helps us to confirm that we've done our job.
The Trident helps us perform precision surgery. It's a really integral part of breast surgical care. Before we had the Trident in the operating room, the specimen would have to go to our radiologist, which is in a separate building, for x-ray and evaluation. A patient may be under anesthesia for an additional 20 minutes waiting for those results. This is quite a lengthy process when you're in the operating room and the patient's under anesthesia. We have one Trident machine. Unfortunately, our Trident is aging, and it's aging to the point where we do not have access to replacement parts.
It's really important for patients to have care close to home in their community because it makes access to care just so much easier. People can bring family with them, and so that is also a huge part of a person's care is to have their support team near them. And getting this new technology is really important part of that. And for them to know that the care that they are getting close to home is high quality.
It's hard to have peace of mind with a cancer diagnosis. So with that in mind, I love to think that we're part of advancing their care and providing more and better options going forward.